Hello, everyone. Thank you for joining us. And today on Perspectives, we will learn more about the PACT Act and how local veterans as well can receive their benefits. And we'll also find out about an upcoming free Veterans Enrollment and Benefits Fair. Well, if you're asking now, what is the PACT Act? Well, it's a law that expands VA health care and, most importantly, the benefits for veterans who were exposed to burn pits, Agent Orange, and other toxic substances while on active duty. The full name of the law is the Sergeant First Class Heath Robinson, honoring our promise to address Comprehensive Toxics Act. That's the PACT there. Now, the Veterans Administration says that the PACT Act is possibly the largest health care and benefit expansion in VA history. This law, they say, will help the VA provide generations of veterans and their survivors with the care and benefits that they've earned and deserve. The PACT Act will expand and extend eligibility for VA health care for veterans with the toxic exposures and veterans of the Vietnam, Gulf War, and post-9/11 eras. If you were exposed to toxins or other hazards during your military service at home or abroad, it will add more presumptive exposure locations and more presumptive conditions for the burn pits, the Agent Orange, and other toxic exposures. Now, that also includes sand and dust and particulates, oil well or sulfur, fires, chemicals, radiation warfare agents, just to name a few others. Our guest today on Perspectives, Sean Shank. He's the Chief of Community and Public Engagement with the Gulf Coast Veterans Healthcare System. He's based in Biloxi. Sean Shank is also an U.S. Air Force veteran. And on his list of credentials, he has served as a state commander of the VFW, the Veterans of Foreign Wars. Well, after a quick break this morning, we'll learn more about the historic expansion of the Department of Veterans Affairs health care and benefits for veterans exposed to burn pits and Agent Orange and the other toxic substances. And, of course, the upcoming Veterans Enrollment and Benefits Fair. Sean Shank joins us in just a moment when Perspectives continues. Welcome back. Today, our very special guest, Sean Shank. He's, as mentioned, Chief of Community and Public Engagement with the Gulf Coast Veterans Affairs Administration. Sean, thanks for joining us today.
Thanks for having us, and I'm excited to be here and talk about veterans.
So much, you know, and in reading your bio, I mean, you have really been a patriot and a servant for veterans and survivors. And your career has just been interesting when you talk about the things that you prepared yourself for. And now that you are here on the Gulf Coast, you're working, of course, out of Biloxi, but your territory is expansive when you look at from Pensacola, Florida, to how far north of the Mobile area.
So our territory goes actually from Biloxi all the way out to Panama City.
Okay.
And so we've got a main hospital, and then there's 5 clinics in between. And so we have a clinic right here in Mobile. Mm-hmm. And it's gorgeous, if you have ever seen it.
Brand new, we love it.
And right, and that's what our veterans deserve. And then we also have a clinic more relative to your viewership in Panama City. And that clinic has actually expanded. That one is gorgeous and it's very large, but it's actually expanded and offered more services to those veterans that live in the area. And
when you talk about numbers, how many veterans are in that area?
Yeah, so what we take care of is about 114,000 veterans. And that number is growing at a double-digit rate depending on which area you're looking at. And so veterans have come to the coast, they've loved it, they've retired, they've come down here seeking jobs, and so that growth has really caused us to grow and respond to their needs.
When you look at some of the areas, and we'll talk about that in our program today with you, but when you look at some of the areas of where the healthcare growth has taken place, what is the, I guess you say, the largest area where you're seeing that growth right now?
I think we're really seeing the largest growth right in that panhandle of Florida, right near Pensacola, and kind of expanding out, which is why we're really putting an emphasis on increasing services and paying attention to that veteran population. That's also part of the reason why we're holding that April 6th event in Pensacola, is to target those veterans. You know, the interesting thing is last time we did an event in Pensacola where we brought in benefits and we did those toxic exposure screenings, we brought in more than 600 veterans looking for benefits and services that day. And so that really told us there was a need, and we want to make sure that we give those veterans an opportunity to get connected with the benefits that they've earned.
You know, very important. And when you talk about those areas from the PACT Act and what it covers, give a little history about that and how it finally came about, because I know that over the years, different veterans groups have been fighting for better service in areas where they were dealing with toxins. And now, after some of the things that happened in the Middle East, even more so. So give us a little history of that, how we got to where we are now.
Yeah, so like you had said earlier, as I'm an Air Force veteran, I'm also an Iraq War veteran. I was in those areas where there were the burn pits and some of those toxic exposure screenings. And so I'm proud to be working at VA, where we're taking care of my brothers and sisters who serve next to me. It's one of the proudest things I've ever been able to do. And so as we're doing that, what we're actually doing in VHA, which is the Veterans Health Administration, is we're giving veterans those toxic exposure screenings. And because we have such close partnerships with our counterparts in VBA, the Veterans Benefits Administration, they're coming out too. And so when a veteran walks through the door on April 6th, they can get that toxic exposure screening, get access to other services that VHA offers, and then VBA will be there to connect them with the benefits, service-connected disability and other benefits that they may be inquiring about or that they had applied for. They'll be able to do that right there, one stop.
And so when you talk about this being an historic time in the VA where they're looking at restoring these benefits to the guys, how far back are you going?
So the PACT Act really talks about exposure to toxins, right? And so what they traditionally look at are the Vietnam vets all the way up to Iraq and Afghanistan, the most current conflicts. And so they're really looking at that time frame because those veterans are the most impacted. But that's a large array of services that veterans who may have tried to talk to VA or approach VA before and for whatever reason couldn't utilize the system, now they actually might be eligible. And so we want them to come and talk with us, especially on April 6th if they live in that area.
Now, what about survivors? How do they play in there? Because in some cases, in the information that you share, you know that the spouses have been impacted if their military service member had exposure to any of these. How do they work into the equation? Because you're asking for them to come as well.
So there's a couple things. And so the biggest support system a veteran has is their family and friends, right? And so we know that when a veteran approaches the VA, a lot of times that is with support of their family and friends. We also know that their family and friends are impacted by that veteran's success and health and everything else. So that's why we want them to come. But additionally, each case is so nuanced and so individualized because each person had different experiences that we want them and the family members to come and have that conversation with us so that we can most accurately take care of that veteran and link them with the benefits.
When you talk about that Vietnam veteran, is Agent Orange, say, the only one that people think of, or are there others? Because we have a list of different ones that you're talking about. But give us an idea of what that Vietnam era veteran may have been exposed to.
Yeah, so I think the best case scenario, what someone should really do is jump on that va.gov, that PACT Act. There's a list of presumptives on there. So that would be my first step. But regardless if you see what you're looking for on there, I would highly encourage you to talk to your primary care provider at the VA. If you're coming to the VA and getting health care, talk to your primary care provider. They are really kind of the tip of the spear for that toxic exposure screening. But then you can also come to the event and have those conversations, because here's the key part is we want to make sure that we're tracking all your healthcare needs and we're paying attention to those specific needs that you have, whether it's on the presumptive list or not. We want to make sure we're tracking those specific needs to make sure that you live the fullest life that you can live.
It really sounds encouraging to hear what you're sharing, because so many people over the years have had issues of where they didn't get the attention maybe that they needed or the right ear to get there. And you yourself, you use the VA for your personal health care. And so that is almost a testament to people who are considering this today when they hear something like that, because they say, well, Sean knows how the system works from the inside as well as the outside. And I guess you can say, how important is that for the veteran to feel that he will be heard, or she will be heard also when they come to the VA?
So I'd like to talk about a couple things. I am a patient because I believe in the system. I also know that we provide the best health care in the world. That's not just Sean saying it. You can look at our ratings and compare it to other sectors and see that we are the best healthcare system in the world. The other thing is my dad's a Vietnam vet. I come from a family of veterans, right? And I have advocated step by step of them coming to the VA system. And I appreciate the experience that my father had coming home from Vietnam, and those experiences should never happen to any veteran. But the deal is that the VA has changed. We are here to help veterans connect to the benefits that they've earned. Secondly, 30% of employees at the VA are veterans.
That's right.
And so chances are, when you walk through the door, from your interaction, you have interacted with a veteran employee, whether it be myself, your provider, your nurse, the person at the desk who's scheduling your next appointment or checking you in. Those are veterans. And so when you come to the VA, you are really looking at veterans, taking care of veterans.
And that's important.
Yeah.
That is very important because it's good to have an ear who has an understanding of what you may have gone through, or they've gone through it themselves. So it helps a lot.
Absolutely. And I think we also have to get past that misnomer. You know, when I go out and talk to veterans and I talk to the veteran community, a lot of veterans go, well, I'm going to save that for someone else. And that's just not how the system works.
Right.
Right? This is very much a use or lose system. And so if you come to VA and you use VA services, you're actually making it better for other veterans. Because the more veterans that use the system, the more services that we can provide, but also the more services we can specialize towards the needs of the community. So you should be coming in and doing a primary care appointment at minimum with us and using the VA for your services just like I do.
We're going to hold it on that point, take a quick break, and come back and talk more. And, of course, give you a chance to sell us on our local facility here, which is, 3-4 years old now? COVID sort of messed up the time frame. It was before COVID that it opened, but it's still basically a new first-class facility here. We're talking with Sean Shank this morning about the Veterans Administration and VA healthcare, as well as an upcoming health fair. We'll tell you more in just a moment. Welcome back. Our guest this morning, Sean Shank, and we're talking about the Veterans Administration and the medical care as well as benefits. And PACT Act is sort of the thing that opened this door up for our conversation, Sean. How important is that we address that now? Because you having served overseas in Iraq during that period of time, I know you're aware of people who were exposed, and you haven't told me all of your story. You may have been exposed to some of those burn pits as well. How important is that we're addressing this now?
It's extremely important, especially for my generation of veterans with the burn pits. You may not be seeing symptoms now, but by showing up and identifying your deployment, your location, what you were exposed to, that allows your primary care team and your care team to track your symptoms and your health for the rest of your life to make sure that you're living the fullest life. Right? And so it's extremely important to come and talk with the toxic exposure screening, sit down and talk with the benefits side to get that service-connected disability so that we are talking together and making sure that you have a whole system that surrounds you and takes care of you. And
we were talking, you know, there's a list of different things, and as you mentioned that the expansion of the program has also expanded some of those presumptive exposures. And where did you say that veterans should go to look those up to see what might apply?
You can always jump on va.gov. That should really serve as your source. There's enrollment paperwork on there. There's information about PACT Act. There's information about service-connected disability. va.gov should really be your #1 source. But secondly, you can jump into Google, which everybody can do on their phone, and type in PACT Act and look for that va.gov website, and then you can pull the information out off of that. And there is just so much information that we probably eat up the rest of your show talking about it. Yeah. And I'm not sure I have it all memorized.
I know there is a long list, and there were new ones that I wasn't familiar with that we added as preparing for the program. So it gives them an idea of if their particular one qualifies.
Absolutely, and that's why I keep advocating for people to come and talk with the specialist. I'd hate for anybody to self-eliminate or self-disqualify them and not come. Each situation is so nuanced and so specific that if you come and talk with a specialist, they'll be able to address your specific case. They'll be able to address your specific exposure. But the key is that there's going to be other supportive services, specifically on April 6th, that are going to be there, including one of my favorites, telehealth. Right, we have one of the largest telehealth systems in the United States.
And you were highly complimentary of that service now. It is really opening a lot of doors.
Absolutely. And so if you're a veteran here in the Mobile area and you use the, we call them CBOCs, community-based outpatient clinics, you use the clinic here, right? That clinic can take care of a lot of your needs. But some of those needs that it can't, we have this telehealth program where your provider or that nurse can sit with you and connect you with a specialist across the country. Or you could be getting services such as maybe mental health services from the comfort of your own home on your couch. And so having access to care regardless of where you're at is extremely important, which is why it's important that veterans actually connect with the VA.
And I love you brought that up about the mental health services, because a lot of guys are still, and I need to get used to saying guys and girls, they're dealing with some things from their time in the service, and that is like right on top of what the need is, and you're now providing that type of care. That's so important.
Absolutely, and we're leaders in that kind of area. And then we have the crisis hotline. We have access to health care sometimes if a veteran shows up in distress, same day. And so we have those specialists who deal with that. And again, a lot of those specialists are veterans. And so when you're sitting there talking about those issues, but that's really what VA is about. We're really about supplying a veteran with all the supportive services they need. I'm famous in saying that when a veteran comes to a hospital, they may not be walking in to see a primary care or specialist. They might be walking in to sit down and talk with a social worker because they might have housing instability, right? They may have just lost their job and they're trying to find someone who can help them find a new job. They may be looking at going back to school and they're looking for educational benefits. We really serve as a full wraparound service to veterans to make sure that they're taken care of.
So important today. Now, we were talking about the upcoming health benefits fair and the importance of coming there to take advantage of what's PACT is offering, but also just all the general services. So that's happening. Give us the date and times again. And you're also bringing folks in from Montgomery and Florida as well.
Absolutely. And so those events are happening. Our next one is April 6th. And services from Southern Alabama, South Georgia, and the Panhandle of Florida are coming together to make sure that we give not only all the VA services, but there'll be supportive services from the community that are there. And so veterans should really show up at 8 a.m. And it'll go till 12, so that we can try to make sure that we connect you with everybody that you need to talk to. And the beautiful part about it, which is why I love the coast so much, it's only, what, 45 minutes down the road? Right? And
I-10 is a great connector.
Right. It's amazing how many times I don't get too far off I-10. And so just 45 minutes down the road, it's happening.
And where exactly? Tell us where.
That's at the Pensacola VA clinic. You can look in Google address. It's kind of nested real nicely in the Navy base that's right there. And so it's a 2-story clinic. It's absolutely beautiful. And like I said, we're actually expanding services working with the Navy so that we can give more service to the veterans in that area, but also in Mobile.
And talking again about your telemedicine, what difference is that making for the guys, say, and ladies in the Mobile area where those services are not available here? They now have access through telemedicine.
Correct. There is an array of services that we can provide veterans through telemedicine. Some of that can be done in the privacy of your own home. Some of it will actually happen at the clinic with a technician or a nurse sitting there and the specialist across the screen, and they'll be doing whatever they need to do to provide you. What that does is, if that specialist isn't here, it prevents you from having to travel or even go out in the community. We can get that specialist in California or Alaska, it doesn't matter, and bring them to you with the supportive health services that you need. And so this is really big for veterans who live in rural areas too. Right? Yeah. If you're able to access healthcare through the comfort of your own home or just by driving 45 minutes and you can see a specialist that you necessarily wouldn't have had access to, that's huge, and that's completely free. And it's free for every veteran that uses the VA healthcare system.
That is awesome. and when you look at the need, what do they need to have in their home to be able to make that connection? Is it phone only, or do they need a laptop, or what exactly do they need?
So basically, Wi-Fi connection.
Okay.
Any place there's internet connection, you are good to go. I know certain veterans actually have gone to other locations next door to their house, sat at a coffee shop, and put earbuds in and talk to someone. And then it can be done from your phone, a tablet, or your laptop. If you're having issues accessing that type of equipment, you should reach out to us, because there are certain programs that the VA will actually help you acquire that equipment so that you can maintain your appointments on time.
We've got a little over a minute left, or a little under a minute left. Make a plea to veterans who are watching today to take advantage of this upcoming health fair and benefits opportunity.
Absolutely. If you're a veteran and you have not engaged in the VA, or you have engaged in the VA, this is an opportunity for you to really understand all the benefits that you have earned. You should absolutely show up, sit down with the toxic exposure, sit down with VBA, and do your benefits. Like I said, we had over 600 veterans last time. And then all those supportive services. So if you are a veteran, you should be using the benefits you've earned, and April 6th is a great opportunity to do that.
Sean, we thank you for coming today and sharing and being a part of this. And you can tell the passion you have for the veteran community, and it's so important.
Yeah. I thank you for having me. From one Air Force veteran to another.
There you go.
Thank you for having me.
Thank you so much. And of course, you can reach out to the information we have available there for you to contact for more information or questions. You see it there. We've got a couple of our specialists who have their website, as well as, I should say, their email address for you to reach out to, and phone number as well. You can always pull those up to take advantage for more information about the VA benefits. Well, thanks for joining us today on Perspectives. You can also see old programs, the ones that we will show you with more information that you have on different subjects that we have covered. We thank you so much, and we'll see you back here next time on Perspectives.